Hi, in this video I'm going to talk about a very common problem or issue after a diagnosis of breast cancer. You have a symptom, meaning something hurts or aches or twinges or flinches or flashes, and you don't know what it means. And you wonder, and it's very normal to wonder, is this breast cancer related? Is it related to my treatment? Or perhaps even more concerning, is this a sign that my breast cancer's come back? I've been taking care of people with breast cancer for so many years that I can tell you this is very normal. It tends to get a little better over time. So as you get further and further out, that sort of hyper-aware state gets a little better. But there's still some things that trigger it. Fears and concerns about recurrence come up when you have a symptom where you don't know what it means. Fears of recurrence come up if somebody who's a celebrity is diagnosed with breast cancer. If somebody you know is diagnosed with breast cancer, and something I see all the time is if you have an appointment for a mammogram or a doctor's visit, people will all of a sudden get new worries and concerns. I just want to tell you that's normal. There's nothing wrong with you. You're not being a hypochondriac. We actually ask you to be in touch with your body, right? We ask you to listen to those, and we say things like, let us know if you have any concerns. And then, of course, you get something, you don't know what it means, and you wonder, is this my breast cancer coming back? There are a few symptoms that we do want you to pay attention to. So any abnormality in the breast that had breast cancer or the other breast, let us know. Most people do. I'm talking about lumps or bumps or hardening or thickening or little red nodules on the skin. Let us know if you have swelling under your arm or you feel lumps under your arm, those kinds of things. We do want to hear about. In fact, we want to hear about anything you worry about. I'll give you my rule of thumb, which I've learned from my patients, is if you have a symptom that you're worried about and that symptom lasts for 5 days or more, or your worry lasts 5 days or more, you should call us. It's our job to answer your questions. That's what we do. And we go into this field because we like helping you get through breast cancer and its treatment. So you're not bothering us, and if your doctor implies that you are, this is a problem. And you can view our video on how to work effectively with your medical team if you want to learn how to handle those kinds of issues with your medical team. But in brief, if you're worried, we want you to call out to us. Reach out to us, use the portal, make a phone call. You can call any of the doctors involved in your care. You can call your primary care doctor. It's very likely that we'll ask you more questions on the phone, and if your medical doctors are like mine, you have to go through several people before you actually talk to the person who can make a decision on the next step. That's normal. Be patient with us. We just want to get you to the right person. More questions will be asked, and if we're concerned, we may order a test and then have you come see us. If we're not, I usually say, let me know if this changes or if it continues, and we'll see you at your next visit. What I found is most people find hearing that their nasal congestion is most likely a cold is very reassuring to people. You'll get better and better at knowing what you should worry about and what you should not. For example, if you have another medical condition like arthritis leading to joint aches and pains, you're going to know what joint aches and pains feel like. It's also possible some of the treatments we've put you on can cause joint aches and pains, like aromatase inhibitors. If you want to learn more about whether they're part of your treatment plan, visit Yerbba.com for your personalized report. In brief, these are really common symptoms that we tell people about, but when you're starting on a new medicine, you don't always hear. And how many of you actually read the patient insert? I actually tell people not to read a lot because it can get you more worried than not. So I've covered, the 5-day rule, the fact that we're here to help you, the fact that it's normal and you're not a hypochondriac. It's part of listening to your body. If something lasts long enough that you continue to be worried, you're fretting at night, or the people in your family say you should call, do it. Just call and we can help. If it is a recurrence of your breast cancer, we're going to get you treated right away. There are lots of treatments for recurrent breast cancer. Of course, that's not what we want it to be, just like you don't. And one can understand sort of putting it off for a little while because we're afraid. But we're here for you, and we want to help you get through these tricky times. As far as the other things like celebrities being diagnosed or a friend being diagnosed or commercials or October, right? With all the pink of October, this can really heighten anxiety. Know that it's normal. Reach out to your supports. If there's a support group in your area you can reach out to, that's great. Now that everything's on Zoom, there are lots of options for you to get support. We'll have some links below, and you can check out our blog about support groups. I hope this has been helpful. I've covered a lot of things. If it has, click like and subscribe, because that will help other people who might have the exact same questions find this video.